Do you think that CalPERS has a sound investment strategy? If you could grade it, I guess, what grade would you give the fund on its investment strategy?
I guess I still think it's a A- probably investment strategy. Think, you know, I mean, the market did fall. Everybody lost money. Maybe there were some investments that could have been done differently, like in real estate, you know. But I think because they do have a new investment officer and a new CEO, I think that some of the changes that they are making at CalPERS will help put the fund on more solid ground. I do think that risk is a key area, and having the risk assessment inside CalPERS is critical, because everything is about risk. You know, I mean, every investment, it's about, well, what is the risk, right? Because the higher the risk, the higher the return usually, and so all of those things have to be weighed. And CalPERS has time. You know, they have more time than I do to make money.
The California Foundation for Fiscal Responsibility, I'm sure you know who those folks are. They have filed an initiative and are attempting to collect now signatures to get on the November 2010 ballot new boundaries for benefits for new public employee hires, state and local. Where do you stand on their proposal?
Opposed to it.
And why?
Because as a public worker, our wages are typically less than what you could earn in the private sector. And the benefit that we get from providing service to the public is health benefits and retirement. And those, I think it'll be very hard to recruit people. You really need good, qualified people in the state. It's very important work. And schools and the state university system, all of those are very important jobs to, for the state of California. It would be very difficult to get people to stay in public service if the defined benefit was reduced to that level.
Are things then fine as they are with CalPERS, or are there some changes, reforms that you would like to see to assure its long-term stability and viability?
Well, I'd have to investigate, you know, a lot of the things that are happening. I have mentioned good corporate governance before. I said that on the radio. Because I think it's been shown, you know, that some of the profits from these corporations are basically going to the CEO and the board of directors because they were making such huge salaries. And I think it promotes greed, and it promotes a whole environment of not really caring about the company itself. And that's been proven. So I do believe that good corporate governance is really important. I think we're going to see a lot of changes around that, you know, because people now realize that they've been ripped off, you know. I think that also you know, besides the investment side, the health benefit side is critical. You know, they've played a really big role in looking at trying to affect the healthcare delivery system in California, because they do purchase, you know, health benefits or health insurance for 1.2 million people in California. And I think that the reform of the healthcare system is critical, you know, to all of government, because it can reduce the amount that's paid. Most state workers like myself, the employer pays the same amount for my retirement as they do for my health benefits. So it is a very high cost item that could be reduced through reform. So I think that that's one side that I can really see could be affected. I think the defined benefit, like pension spiking, people like, usually it's usually not the rank and file, it's usually management that get rewarded their last year of state service if they have the highest year, and it increases their retirement substantially. I do agree that there should be some kind of averaging of the highest wages that would then, in effect, stop pension spiking. You know, so that's one thing that I'm really, you know, concerned about. But the average, you know, retirement benefit is only $2,000 a month, and you'd be surprised how many people actually come to work for the state, which I'm more familiar with because I'm a state worker, to provide benefits for their family. You know, because their husband doesn't have medical insurance, or no medical insurance, you know, or maybe not a very good retirement. So there's a lot of, you know, people that are providing health care for their family because they're a state worker. So I think that's something that should be looked at.
Why exactly do you want to be on the CalPERS board?
Well, I think the board has the responsibility to direct, you know, set the direction. You know, the board is can really influence the direction that CalPERS goes. I think my experience, I was a budget analyst at Caltrans for many years, working on the governor's budget, and I think that really taught me to look to the future. Budgeting is really about planning for the future, and I think that it's, you know, I was also involved in negotiating, you know, health benefits and retirement for Local 1000. And I've really learned that it's critical to really be a representative, to not get so full of yourself that you think you know all the answers. And I think that it's time for a person to be on the board that has fresh eyes, it's not tainted, that isn't there as a status symbol or wanting to later on make a lot of money. So that's why I'm running.
And what is your education and you know, quick synopsis of your work history with the state?
Okay. Well, education, I have a BA in social work. I initially wanted to be a social worker. And I started out, and then I later on got a degree, a master's in public administration. But I started out as a key punch operator in state service. I worked for the private sector before I started state service. I worked for Bank of America. I worked at a manufacturing Gerlich's in San Francisco. I worked at American River College. But after I graduated, I wanted to work for the state for the benefits, basically. You know, I wanted to have good health benefits and a retirement. And so the first job that I was able to qualify for was key data entry operator. Right down the street, Capitol, Crocker Bank, if you're from this area, it was on Capitol Mall, and it was in the basement. And then I promoted up, you know, took state tests and promoted up to associate budget analyst. And, you know, worked at Caltrans for 11 years in budgets. But I got involved in my union really early on. 1984, I became a steward in my union and negotiated, I actually got upset with, at that time, you know, CSEA, because they had negotiated a contract where they had reduced the sick leave from 8 hours to 7 hours. And I was a person who really wanted to find out, well, why did that happen? And so I talked to them and I said, well, how did that happen? And they said, well, you know, they do have people that are elected that are on the bargaining team. And I said, well, you know what?